Hey guys, welcome back to UWorld's Next Gen NCLEX review. My name is Nurse Nicole here with another question drill set. Hello, welcome in. I see all of y'all, or not all of y'all, some of y'all were already chatting in the chat and I love to see it. If you are new here and don't know how a question drill works, it is something that we do every week to help get you ready and prepped to take the NCLEX with NCLEX style questions. I will pull up a question up behind me, give you about 30 seconds to look over it, read the answer choices, and then I will go over why the right answers are right and the wrong answers are wrong. We have Nurse Samantha in the chat also moderating for us today. So if I go a little bit too fast, or you need some reiteration on a certain answer or some rationales, she will be in there to answer all your questions. But I also just like to ask fun questions in the chat to get the chat going so I can see and have a little community here on the side. So without further ado, let's get started. Today's topic is fundamentals. So think all the things, the basics, the foundations, everything you kind of need to know at first before going into med surg, critical care, peds, all your specific topics. So let's go over the foundations, the fundamentals. First question. The nurse is caring for a client who requires neutropenic precautions. Which of the following actions should the nurse take? Select all that apply. Option 1, request a prescription for the intranasal influenza vaccine for the client. Option 2, place a surgical mask on the client during transport. Option 3, remove fresh flowers from the client's room. Option 4, assign the client to a private room. And then option 5, instruct the client to bathe daily. Let me know what you guys think in the chat. Hello everyone. Oh, so many people saying hi. Love to see it. Hello, let's get started. Drop your answers in the chat. This one was a little bit tricky in the morning. We had some people going back and forth about one of the answer choices, but I see some of you guys are including it in your answer choice. This is the select all that apply, so there is more than one right answer. But hello, Miss Atonga from Instagram. She says she's back again. Way to be back and on time so you can get the full 8 questions that we're going over today. Let's see if you remember what the answer choice maybe was for this one, or if you missed it. Lots of 2, 3s, and 4s. I will let you know that there might be another answer choice in there. Lots of good answers. Good job. Good job. Make sure to also follow us on all social media platforms. Instagram, TikTok are our main big ones that we do, but we also do Facebook and YouTube. There's a lot of people on YouTube usually in the afternoon. So follow us on all your favorite social media platforms so we can stay connected. Okay, the correct answer is options 2, 3, 4, and 5. So with neutropenic precautions, what is neutropenia? That is when you have very low white blood cells. And those white blood cells are very important so you can fight off any infection. And if you don't have enough white blood cells, you are prone to get infections very easily. So we try to put them in the most clean, most almost like sterile type of environment to try to protect them from getting any infection. So these options 2, 3, 4, and 5 would be the best things to protect them. We want to place a surgical mask on them during transport so that whenever they are outside of their sterile or clean environment, they're less at risk for those droplet infections. Option 3, remove fresh flowers from the client's room. This is also a correct teaching because those flowers and plants can harbor bacteria and fungi, and that is prone for an infection because they can't fight off that bacteria. Option 4, assign the client to a private room. That's that clean, sterile room with just them and their own personal germs, which they don't usually have that much. But then option 5, instruct the client to bathe daily. It's not necessarily like sitting in a bathtub bathe daily, but you want their skin to be clean. So a good rinse off in the shower with non-harsh chemicals, which is the soaps that a lot of people think of when you're bathing daily, and that's that soap that's going to dry out their skin and cause them prone for skin breakdown. If you're just bathing and rinsing off daily with non-toxic or non-harsh chemicals, or just like rinsing off, that is okay for the skin to keep that skin clean, because that is the easiest barrier for them to get the infection. So we actually do instruct them to bathe daily, but you guys are doing great. Next question. The nurse is planning care for a client who has an indwelling urinary catheter. Which of the following interventions should the nurse include in the client's plan of care? Are we doing option 1, applying tension when securing the catheter tubing to the client's inner thigh? Are we maintaining the urinary drainage bag above the level of the client's bladder? Are we emptying the client's urinary drainage bag when it's completely full? And then are we cleansing the client's perineal area with soap and water? Let me know what you guys think. Oh, we have Miss Gifty on TikTok that just passed her NCLEX. Congratulations. Welcome to the RN world. That is awesome. Let me know any other recent NCLEX passers or people that have just scheduled their NCLEX. I know summertime is a very popular time for everyone to take their NCLEX. So let me give out some shout outs to recent NCLEX passers or schedulers. These past couple weeks, we've been having people doing it in the next 2-3 weeks next month. So let me know. We have someone going next week off TikTok, Mr. Thomas. HK82 on TikTok has hers July 7th. That's coming up very, very soon. June 25th, sorry, Nurse Bang on TikTok. Good luck to you. Callie Tedford on Instagram takes hers in 5 days, the final countdown. Good job. Scheduled for Saturday, Maggie on TikTok. Tomorrow, A on TikTok. Scheduled for next week, fingers crossed. Fingers crossed to you. Actually, not even fingers crossed. You got this. You got this. You're going to do great. Thanks for tuning in and getting some last minute studying in. Nutel on YouTube takes theirs in 2 weeks. Whenever you go so fast, it makes my eyes like do cross-eyed. Abs on TikTok took hers yesterday and is waiting for the results. You got this. You're going to do great. You've done great. The worst is behind you. Then we have someone on August 15th, July 8th, tomorrow, July 8th. There's a couple different people on July 8th. So y'all are all taking that at the same time. You're in it together. We're in this together. The correct answer for this one is option 4, cleanse the client perineal area with soap and water. This would be the correct action. What we should do, all the other ones are things that we're not going to do. We're going to clean that perineal area so we don't introduce any bacteria and they don't get a CAUTI, which is a catheter-associated urinary tract infection. So clean it with soap and water. Keep it very, very clean, or else JCO and all your managers and stuff will be at you for a CAUTI. Option 1, 2, and 3 would be incorrect teaching. Option 1, we do not apply tension when securing the catheter tube. Not only is that uncomfortable, but it can cause trauma to the urinary tract system itself. So never apply tension. You always want to give a little slack, especially so they can move their leg. Option 2, maintain the urinary drainage bag above the level of the client's bladder. Again, this is incorrect because we don't want to usually ever have it above the client's bladder. You want it below so that urine won't backflow back into the client, which could cause the urinary tract infection. And then option 3, empty the client's urinary drainage bag when it's completely full. Again, we would want to do it way before completely full. I always say best rule of thumb is 1/3 to 1/2 full, so we don't have that backflow of urine that can cause that UTI. So good job, guys. Y'all got that one easy. Next question. The nurse is screening clients for those at risk for developing pressure injuries. The nurse should recognize the client at highest risk for developing a pressure injury is the client who what? Option 1, frequently slides down in the bed. Option 2 is experiencing constipation. Option 3 has an indwelling urinary catheter. And option 4, ambulates with a walker. Let me know what you guys think in the chat, and we'll go from there. The chat is popping today. Love to see it. Lots of correct answers. Hello to people as well. Good job, guys. With your answer choices, do you want to put some rationale on why that answer is the correct answer? Let's help other people out that are thinking other choices. Because I'm seeing lots of ones, but I'm also getting some 3s and 4s. Someone's saying it causes friction, shear forces, sliding causes friction, friction creates friction. I think we're all on the same boat with the friction. Sliding does cause friction. And so that frequently sliding down the bed, that's going to have that skin bump, or not bump, like slide on itself and cause that friction against the bed and against their own skin. So that is the highest risk for developing a pressure injury. It's not to say that any of these other choices aren't going to be a high risk for a pressure ulcer, but it is the highest risk out of all 4 of these. Option 2 is experiencing constipation. This one would probably want to be one of the least likely. When you're having constipation, you're usually drier down there in the perineal area, so you're not having any moisture breakdown or skin breakdown in that aspect. So you're usually on the good side, but we do need to assess that constipation later. A client that has an indwelling urinary catheter. Again, your perineal area is usually on the drier side, but sometimes with that indwelling urinary catheter, you're less likely to get up and out of bed, which could pose you as a risk for pressure ulcer, but it's not the highest risk compared to all of the others. And then option 4, ambulates with a walker. At least they're getting up out of bed and walking around. So that is also probably one of our lower risk clients. But you guys did pretty good. Friction, friction, friction. Y'all got that foundation one well. Someone said I should have went with my gut. Always go with your gut. Don't change your answers. Question 4, the nurse is talking with a client who has a colostomy. Which of the following statements by the client would require follow-up? Option 1, I should avoid drinking coffee and alcoholic beverages. Option 2, I need to chew my food completely before swallowing. Option 3, I can continue to swim in the pool every morning. And option 4, I will wait until my pouch is full before emptying it. Let me know what you guys think in the chat. Good job, guys. The answers come flooding in. It's like y'all know this or something. Y'all know the foundations and the fundamentals. Good job. Good job. Good rationales as well. Good job. Love the correct answers in the chat. It's overflowing with 4. I will wait until my pouch is full before emptying it. So going back to like our question a couple questions ago with the urinary drainage system, same with the colostomy bag. You don't want the bag to be completely full or pretty full before you empty it. This will cause skin breakdown, in this case with the colostomy, because that's against the stoma and that can irritate the stoma. But it also can make the bag like burst or leak. So we don't want any of that stuff around us. So empty it way before it gets to the full. Again, I would always say 1/3 to 1/2 full is when we should be emptying it. Options 1, 2, and 3, I should avoid drinking coffee and alcoholic beverages. This is a correct teaching point. Sometimes the coffee and alcoholic beverages can be a diuretic or a laxative. And so that frequently, or drinking that can make you have to frequently empty it, and also can cause GI upset. So we don't want to interfere with the GI system since we already have that colostomy. So it's best to just encourage them not to drink coffee or alcoholic beverages. Option 2, I need to chew my food completely before swallowing. Again, another good teaching point. With their colostomy, their food isn't going through their entire intestines to be digested and broken down completely. So depending on where the colostomy is, some of that food could be still in bigger chunks, which could cause a blockage. So we want to make sure that they are chewing their food very, very thoroughly so that it doesn't cause any blockages in their colostomy or in their tract. Option 3, I will continue to swim in the pool every morning. Another correct teaching, or just something to encourage their independence and a sense of normalcy. So having them swim every morning is okay, because this will be their normal type of morning, and that would be great for them. Next question. The nurse is observing a staff member administer eye drops. Which of the following actions by a staff member would require the nurse to intervene? Option 1, positions the client in the supine position before administering eye drops. Option 2, cleans the client's eye from the outer canthus to the inner canthus before administering eye drops. Option 3, gently pulls down on the conjunctival, don't quote me on that word, sac with non-dominant hand and instills eye drops with the dominant hand. And option 4, repeats eye drop administration if the client blinks and the medication lands on the outer lid. Let me know what you guys think in the chat. And also, we are past halfway through, so now I get to say my favorite question. Where are you guys tuning in from? I love to see how far you world reaches. So earlier this morning at the 11 o'clock session, we had a lot of international people. So let's see if we're back in the States. Where are we tuning in from? I see the Jamaican flag. Hello, Jamaica. Texas, Toronto, California, Louisiana, Seattle, Washington. I was just wearing my Seattle sweatshirt. It's over here. Chicago, Fresno, Toronto, Kenya. Oh, it's going too fast. Nigeria, California, South Florida. Correct answers with rationales. California, Texas, New York City. Ghana, Guatemala, Texas, Zambia, Wisconsin, Massachusetts, Brooklyn, Zambia, Mexico, USA, Kenya, United Kingdom, Maldives. I want to be in the Maldives. Philippines, Niagara Falls, beautiful. Virginia Beach, Houston, Zimbabwe, Ghana, North Carolina, Kenya, almost midnight. Shouldn't you be going to sleep? Thanks for tuning in, though. Nepal, Florida, Fort Lauderdale, Arkansas, in all capital letters. Filipino, Caba. I don't know if I said that right. Ecuador, Liberia. So many people all over the world. I agree. Keep it Zen on Instagram. I agree. So many people all over the world. Beautiful people. Happy Juneteenth to all these United States people as well. Correct answer for this one is option 2, cleanse the eye from the outer canthus to the inner canthus before administering eye drops. So we're looking for an action that is wrong, that requires that intervention for us to fix. So with cleaning from the outer canthus to the inner, we could be introducing bacteria from the outside or from their face back into the eye. We never clean from the outside in. We always clean from the inside out. Bring all that bad stuff out of the eye. So that is why that is the correct answer, because we need to intervene with the out to the in. Options 1, 3, and 4 are all correct ways to instill eye drops. It's kind of helpful to actually act out the type of scenario that it's asking us. So positioning the client supine before administering the eye drops, this is correct because it allows gravity to help you instill the eye drops. Option 3, gently pull down the eyelid. I'm just going to say eyelid with the non-dominant hand and then doing the eye drops with the dominant hand. And then option 4, repeat the eye drop administration if the client blinks, because obviously if the client didn't get the eye drop in the actual eyeball, then the medication won't be able to do its action. So put it in the actual eye. So that is correct and great. You guys are doing great. These fundamental questions are easy peasy for y'all. Next question. The nurse is preparing to administer insulin to a client. Which of the following actions should the nurse take? Option 1, draw up regular insulin into the syringe first and then NPH insulin second. Option 2, hold the insulin syringe with the non-dominant hand and pinch the periumbilical skin with the dominant hand. Option 3, clean the injection site with the alcohol swab and inject the insulin before the alcohol dries. And option 4, check for blood return before injecting the insulin. Let me know what you guys think in the chat. This is another question that you can kind of like act out to see if you are doing the correct type of action. Good job, guys. And like always, be sure to follow us on your favorite social media platform, whether it's Instagram, TikTok, Facebook, YouTube. We post these lives pretty much on all of our channels after we are done. YouTube is usually the easiest if you want to search a specific topic like hematology or oncology, so you can have that actual search bar. But we post it on all social media platforms for you to review later. And then you could also go to uworldnursing.com where you can sign up for other free resources like question of the day or the week, and then a seven-day free week trial. So good job. Oh, I'm loving the rationales. Clear to cloudy. RN, like our licensing, or like our credentials, I should say. Good job. That is correct. Option 1, draw up regular insulin and then NPH. Just like our credentials, always draw up R and then N, regular insulin, then NPH or clear to cloudy. Options 2, 3, and 4 are kind of tricky ways to instill the insulin, so that wouldn't be the best practice. If you hold the insulin syringe with your non-dominant hand, that is more prone, I can't trust myself, so you're more prone to accidentally poke yourself or poke a place that you didn't actually clean with the alcohol swab. So always hold the insulin syringe in your dominant hand so you have a more accurate puncture. Option 3, clean the injection site with the alcohol swab. That is correct, but you want to actually wait till the alcohol dries. So that second part of it is incorrect. Option 4, check for blood return before injecting the insulin. This is a best practice, especially since it's a sub-Q injection. You never want to draw back blood for a sub-Q injection. So you guys did good. Question 7. The nurse is teaching parents at a community health fair about scoliosis. Which of the following information should the nurse include? Option 1, scoliosis affects only the curvature of the lumbar spine. Option 2, surgery is required to correct scoliosis. Option 3, screening for scoliosis begins in preschool. Or option 4, scoliosis can cause unequal shoulder height. Let me know what you guys think in the chat. And y'all can do good. Y'all are doing great. These fundamental questions ain't got nothing on you guys. Also, let me know what topics you guys would like for us to cover. Nurse Samantha did a concept map over TBI yesterday that was really, really good, and another neuro aspect or neuro focus. And then it was great to follow up with Nurse Andrew in the evening. He did a neurology question drill. So let us know what type of topics you guys would want, so then we can maybe incorporate it with concept maps that we're trying to do more often, and then follow it up with a question drill later on in the evening. And yeah, we'll go from there. I saw some pharmacology, which is always top choice, and cardio. Those are always the first two. Cardio and pharmacology. Hormones and heart. I get some good rationales I love it. I love y'all's rationales. Pharmacology, mental health, orthopedics. I don't see orthopedics that much. Maternity, endocrine. I feel like a couple weeks ago, we had a good endocrine lecture. So maybe tune into our YouTube page to find that endocrine lecture. That was actually really good. Pharm, cardiology, OB peds, hematology, yeah. EKGs, yes. EKG and rhythm practice are pretty hard. Good job, guys. Okay, while y'all are dropping those in the chat, I will move on to the correct answer, which is option 4, which someone did say in the chat some other rationales. I forgot, so I can't go back to it right now. But scoliosis can cause unequal shoulder height. That is the only true statement. The best thing to look at these also, or to help narrow it down, whenever they have like definitive time frames like only or always, those we usually steer away from, because there's going to be that 0.01% that's going to hinder that always or only. So option 1, scoliosis affects only the curvature of the lumbar spine. This is incorrect. It can affect the hips, it can affect the shoulders, not just the lumbar and the back spine, the back end of the spine. Option 2, surgery is required to correct scoliosis. It's not the only way to correct scoliosis. You can use a brace instead of surgery. So it's not the only required thing to correct scoliosis. Option 3, screening for scoliosis begins in preschool. This is actually incorrect because it usually does, screening starts a little bit later, not a little bit, a lot bit later, usually around 12 to 14. Think of the adolescent years, like when kids are going through their growth spurts. That's that quick growth, as you would say, and so that spine usually can maybe not grow as quickly as the other bones, and so you have those unequal bones growing. So that's when screening usually starts. Preschool is a little too young for them to be going through any growth spurt, but screening starts a little bit later. Correct answer, unequal shoulder height. When that scoliosis starts growing, or the bones start growing in an unequal pattern, you can have that unequal height because the bones are misaligned and curving. So that is the only correct answer choice, or correct teaching point of scoliosis. Question 8, last question of the day. Make sure to drop in the chat how many questions out of 8 you guys got right today, including this one, maybe not including this one. The nurse is teaching a client with orthostatic hypotension. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. So more than one right answer. Option 1, perform carotid artery massage. Option 2, decrease dietary sodium intake. Option 3, apply graduated compression stockings. Option 4, implement fluid restriction. And option 5, administer fluorocortisone. Let me know what you guys think. Someone is watching from Saudi Arabia. Hello from Saudi Arabia. You also should be going to sleep very soon. I think it's pretty late over there. Someone asked if we are live every day. We are not live every day, but we've added so many lives, we're nearly almost every day. Let's see if I can go through these again. On Tuesdays, we go live at noon with the lecture. On Wednesdays, we have a live at 11 a.m. and 7 p.m. On Thursdays, we're live 11 a.m. and 3 p.m. And all of these are Central Time. Friday, we are live at 7 p.m. and Sundays, we're also live at 7 p.m. So many times that we go live, but not every day, but nearly every day. I think the only days we're not live is Monday and Saturday. We give you 2 rest days, like a weekend. So tune in multiple times. You can see our event calendar at uworldnursing.com. If you miss my long spiel of what times we go live, it is at uworldnursing.com. And then it also tells you the topics that we are going over with each live. So sometimes we might have a different live from the morning to the evening. So check the event schedule at UWorld Nursing. Okay. There's a good variation with this question. We got 2s, 3s, and 5s with the variation. Let's see. We're thinking of hypotension. So think of all the things that would help with hypotension, not hyper, hypo. So a low blood pressure. So yes, we're looking for things that would increase your blood pressure because we're experiencing low blood pressure. Maybe that will help. And someone is asking for immunization topics. That actually is a good one. It can be a little bit tricky because sometimes those age ranges changes depending on like the CDC, but that is a good topic, at least a general consensus of immunization. The one thing I do know is the flu season. Good job, guys. Okay, the correct answer for this one is options 3 and 5. So with orthostatic hypotension, we're having a low blood pressure problem. And then it gets significantly worse when we sit up or when we stand up. So we want some interventions that would help keep our blood pressure on the higher side, which would be applying those graduated compression stockings. This will help the blood in the lower extremities shoot up back to the heart and just helps the circulation. And then option 5, administer fluticortisone. This is a mineral corticoid, which mimics aldosterone, which we know is a medication or a hormone that has you hold on to your salt, and wherever salt is, water follows. So you have a fluid volume excess, and that will help with your blood pressure. So that would be a correct option because we want to hold on to our fluid so we can shoot up our blood pressure. Option 1, perform carotid artery massage. This would actually be helpful for someone who is having a high heart rate, and that would help bring the heart rate down, but not necessarily needed in this case. Option 2, decrease dietary sodium intake. Again, we actually want this sodium in them so the water can follow, so then their blood pressure will go up. So you want to actually increase sodium intake and then increase their fluid intake instead of a fluid restriction like in option 4. You want to increase that fluid volume so we can increase the blood pressure. So you guys did good. How well did y'all do out of 8 questions today? It is the fundamentals, but these are all things that you can carry over to the many different topics and the many different classes that you will have coming up in the next couple semesters going through. So I hope you guys did good. If not, we have many other chances for you to tune in and to get some more help with some live and free resources. So you will have Nurse Andrew tomorrow at 7 p.m. and on Sunday at 7 p.m. So I will see you guys next week. Have a good weekend.